Winter has arrived in the Northern Hemisphere, and with it, huge surges in patients with respiratory illness. A so-called triple-demic has left many hospitals overwhelmed. There are effective vaccines for two of the diseases behind it, COVID-19 and influenza, but there isn't one against the third pathogen, RSV. But it looks like that could soon change.
Respiratory syncytial virus, or RSV, can pose a particular danger to newborns like Andreas because the inflammation and mucus it causes can block the tiny airways in their lungs. Like in many places in the Northern Hemisphere, pediatric hospitals in Germany are currently struggling to cope with a cresting wave of infant patients.
Usually, chaos breaks out in the late afternoon. Then the emergency room is full and no more beds are available. My poor assistants spend hours, literally hours, on the phone trying to find a free bed for the children.
And although generally pretty harmless for adults, the virus can also hold dangers for the elderly. Unlike other common respiratory diseases like influenza or COVID-19, there are still no authorized vaccines to help reduce the ravages caused by RSV. Despite decades of efforts, it's proven difficult to develop them. They're long overdue.
So RSV is the #1 healthcare burden in under twos in the winter season. RSV bronchiolitis is a massive healthcare burden. Not that many babies die from it in modern Western countries because the supporting therapy, with oxygen, is very good. But if you have an RSV vaccine, it stops those babies coming into hospital even in the first place.
Now options could be around the corner. An RSV vaccine candidate developed by Pfizer for expectant mothers will be submitted for approval in the next few weeks. It's been shown to also protect their newborns directly after birth. And a Pfizer vaccine for the elderly isn't far behind. Rival GlaxoSmithKline is also seeking approval for its RSV vaccine next spring. Important steps forward in protecting the most vulnerable from the worst effects of a potentially deadly illness.
For more on this, I'm joined now by Ralf Reintjes, Professor for Epidemiology and Public Health Surveillance in Hamburg. Good to have you on the show. In your assessment, just how bad is the current situation in Europe during what's being called a triple-demic?
Yes, it's not unexpected what we're seeing at the moment, that in the autumn and winter that the respiratory illnesses are increasing, but it is so much more than normally in a normal season before the COVID pandemic.
German hospitals are overwhelmed by sick children. Basic, simple medicines are hard to get. Why is Germany so seemingly ill-prepared?
There are lots of different factors which influence this. On the one hand side, of course, the last 3 years and the use of hygiene measures to prevent respiratory illnesses reduce the situation or makes the situation a bit more difficult now, while we have reduced most of the hygiene measures. So all respiratory illnesses can spread much easier at the moment. And on the other hand, also hospital staff are ill to a large extent, and also the healthcare system itself was focused mainly on trying to reduce costs over recent years. So there's not much of a backup in the background which could be used in a more difficult situation like this one at the moment.
Why does RSV appear to be a bigger issue this year than in years prior? Because it's not a new virus.
That's true. But over recent years, over the last 3 years, for example, we used lots of good hygiene measures. We were wearing masks, we had school closures, we had even lockdowns, which reduced contact of people and the spread of lots of viruses, not only coronavirus, which at the same time then produced more susceptible people at the moment because nobody got it at that time. And at the moment, with not so many precautions being taken, all respiratory pathogens have a much better opportunities to spread, and that's why we're seeing this big wave.
Talking about health measures and hygiene measures, you have warned several times Germany might see surging illnesses this winter. Do you think that stricter measures are needed to get that surge under control now?
It's not only me, lots of my colleagues also were quite aware that this autumn and winter is going to be the more difficult one for several reasons. And it's not always not good if you go from white to black or black to white from one extreme to the other. Being very careful for the last few years and being less careful at the moment, of course, is not very helpful, or it's very good for the pathogens, but not so good for us. So better hygiene measures, still using masks indoors when you're meeting lots of other people would not only reduce the spread of coronavirus, but also RSV, influenza, and several other respiratory viruses.
Ralf Rantje is Professor for Epidemiology and Public Health Surveillance, joining us from Hamburg. Thank you for your time.